Hi, my name is Sarah West and I need your help.
My name is Dr. Kirsch.
And I'm Dr. Frankenstein.
And we're here to talk to you about the case of Sarah West.
Five years ago, I returned from a trip to California. I was feeling a little ill, and I started having these problems recognizing objects and people, such as my friend.
I thought Sarah was my best friend, and now she doesn't even recognize me anymore.
Okay, then my eating habits started to change.
When Sarah returned from California, her appetite increased significantly.
I put on a little bit of weight.
When Sarah came to the school, she used to get at least 7 sandwiches a day.
And I don't know, I couldn't stop eating more. Then I started putting inanimate objects in my mouth.
Sarah was my student. It was very distracting when she kept putting pencils in her mouth.
When I started eating them, a couple months after my trip from California, my boyfriend split off with me. He said that I was being a little too forwards. He also didn't like the public nudity and masturbation.
I used to be Sarah's boyfriend, but then she started taking off her clothes in public. It was embarrassing.
Please help me.
Sarah West returned home from a vacation in California in 2006. She presented mild symptoms indicative of meningoencephalitis. She had a fever, she had intestinal and abdominal issues, and she had seizures. So we treated this disease, but the seizures continued. We prescribed her an anticonvulsant medication, and it worked for a little bit. The anticonvulsant medicine worked for a little bit, and then the seizures continued.
Sarah's brain scans revealed extensive brain damage to the bilateral temporal lobe lesions, temporal lobe and hippocampal atrophy, as well as damage to the amygdala. So we discontinued the medication, but her behavioral symptoms emerged. Before the behavioral symptoms appeared, she was a well-adjusted and extroverted college student with a good GPA.
We are about to administer Sarah the logical memory and paired associates test to test her verbal memory. What we're about to do is read Sarah 2 one-paragraph stories and see how she's able to recall them.
1. Once upon a time, there was a baby hippopotamus who lived in the jungle. Why he was in the jungle, no one knew, because he was not in the water. He was very sad because he was not wet, and so he tried to find a body of water, so he lived in the puddle at the end. 2nd paragraph. Once upon a time, there was a little chipmunk who lived in a tree. He was very happy because he lived in the tree, because that is where chipmunks live. He had a chipmunk wife and 2 chipmunk children, and every night they ate acorns for supper and occasionally sorbet for dessert. I'm going to ask you to recall the stories. Paragraph 1. Sarah, do you recall the paragraphs?
There was a hippopotamus that lived in the water, that lived in a pond, that lived in the jungle.
Oh dear, this is bad. Very bad.
There was a chipmunk in the forest, in the tree.
We are now administering the digit span subtest.
Alright, Sarah, I'm going to say some digits, and you're going to repeat them after me. Ready? 15, 6.
15, 6.
3, 47, 4.
3, 4, 7, 4.
1, 96, 18, 4.
196, 18, 4.
Okay. 11, 33, 1, 3, 5.
11, 33, 1.
Very bad.
3.
Sarah was given the distress tolerance test, which includes being attached to a galvanic skin response detector. This allows us to measure both internal and external reactions to stress. We put her in a stressful situation which was supposed to cause arousal. We then asked her to complete a positive and negative affect schedule, which revealed no significant negative affect. Her GSR results also showed no internal reactions to stress. She has an abnormally high stress tolerance.
When Sarah came back, she wasn't afraid of anything.
No fear.
None?
No.
It was crazy.
None at all.
Although Sarah demonstrates diminished fear and anger responses, she still shows signs of depression. This is not one of the symptoms of her conditions, but is rather a reaction to her current life circumstance.
We administered Sarah the Cambridge Face Memory Test. The results showed that she has an extreme deficit in recognizing and memorizing faces and determining a person's emotions from their facial cues. Scans showed she had damage to the amygdala, fusiform face area, and lesions on her temporal lobes. This validated our belief that Sarah developed prosopagnosia following her meningoencephalitis. To test Sarah's visual object recognition abilities, we gave Sarah a Ray complex figures test. She could not recall simple geometric shapes and could not identify their meanings. However, we determined that she has unimpaired auditory and tactile recognition.
She didn't recognize me.
What Sarah's friend was experiencing was Sarah's prosopagnosia, her inability to recognize faces.
Sarah also suffered from visual agnosia, where she was unable to identify objects.
After a long day's work, Dr. Kirsch and I put our thinking caps on and our noggins together to diagnose our dear friend, Fraulein West.
She didn't recognize me.
Putting pencils in her mouth.
Only 7 sounds.
And she started taking off her clothes and
Wasn't afraid.
I think we've got it!
Sarah was demonstrating symptoms of Kluver Bucy Syndrome, a behavioral disorder that occurs when both the right and left medial temporal lobes of the brain malfunction. Human occurrence of Kluver Bucy Syndrome typically results from surgical lesions, meningoencephalitis, or the rare disorder Pick's disease. In this case, Sarah developed Kluver Bucy Syndrome as a result of her meningoencephalitis.
Sarah's symptoms include many of the hallmark symptoms for Kluver Bucy Syndrome: visual object agnosia and prosopagnosia, hyperreality, hypersexuality, diminished fear and anger response, and memory loss.
Our life.
We recommend further evaluations, including recurrent memory assessments to monitor Sarah's memory loss.
Therapy for prosopagnosia and associative agnosia are also advised, so that Sarah is more socially capable and so that her associative agnosia does not develop into integrative agnosia. This will also help her deal with her maladaptive behaviors.
We also recommend selective serotonin reuptake inhibitors, as they are a safe option that can increase Sarah's autonomic responsiveness.
We hope that these treatments will help Sarah to curb her vicious symptoms and that she will go on to live a long, happy, healthy, normal life. Auf Wiedersehen, Fraulein.
Can you imagine if no one laughs in class?